So today we are going to talk about thematic analysis. I'm Professor Aisha Humayun. Assalamu alaikum to everyone. The concept of thematic analysis says that it is a qualitative research method for identifying, analyzing, and reporting patterns, or we call them themes, within the data. It is a flexible and widely used method, particularly suited for understanding experiences, perspectives, and social phenomena. So in which the research in which we get textual data, here we apply thematic analysis. So now looking into what are the different types of analysis other than thematic analysis which can be used for qualitative data analysis. So if you want to identify patterns in perceptions or experiences, then you go for thematic analysis. And if you need quantitative insights from textual data, we can use content analysis. And if you aim to develop a new theory from data, then grounded theory can be used. And if you focus on individual lived experiences, phenomenology is used. If you analyze how people tell stories, that is narrative analysis. And if you study language and power structures, that is discourse analysis. So we will be discussing other types of analysis in subsequent videos, but in this one, we are focusing on thematic analysis. So the steps in thematic analysis that was given by Braun and Clark in 2006. Number one is the familiarization, reading and rereading data to gain an overall understanding. The second is generating initial codes, assigning labels or codes to meaningful data segments. That we are going to do it with example in later slides. So the third one is searching for themes, grouping codes into broader categories or themes, and then reviewing those themes, refining and merging themes for coherence, and then defining and naming those themes, which is also called describing the themes, giving each theme a distinct, meaningful name and a description. Then writing the report, presenting findings with supporting codes. So we need the codes from the data to support the themes, to provide evidence to the themes. The first step is familiarization with the data. The objective is to develop an in-depth understanding of the data, and how we are going to do it. Read and reread transcripts or notes from interviews, focus group discussions, or other qualitative sources. When you read it at least 3 times, then you can get a clear understanding what kind of codes you see in the data. Like actively listen to the audio or watch video recordings if they are available. But if only field notes are available, then you can read and reread those notes. Take notes of initial impressions, recurring words, or interesting observations. In case of video and audio, then you have to note down the impressions as well. But while taking field notes, we also document the impressions, the body language, gestures, the way of talking, the recurring word, the tone, and some interesting observations while while collecting the field notes. So the second step is generate initial codes. So while generating the initial code, the objective is to organize the data into meaningful groups. And how we can do that? We use line by line or segment by segment coding to label important data features. So this is done by reading each line and identifying the keywords, just underline the keywords, and or you go by segment, and then we can, in the next step, we can see whether these keywords are adequate codes or not, or we can merge them, or we can label them. Codes can be descriptive, summarizing the content, or interpretive, identifying underlying meanings. So you have 2 options. It can be a summary of the keywords, summarizing the content, or it can be some underlying identifying or showing some underlying meaning of that sentence or that phrase. So example could be in a transcript, if a participant says, residents are too busy to attend CPD activities, you might code it as time constraints or workload issues, rather than giving it the residents are too busy or too busy in activities. So you can give it a phrase, a compound word, or a simple word just to show what exact the hidden meaning is, or you can summarize the content in that way. So use software like NVivo, Atlas.ai, or even manual method. And we are going to discuss the manual method here, and then I will be sharing some AI-based coding softwares or the platforms that can help us to get the desired outcome. So we can use Excel for manual methods or a printed copies. The next step is search of themes. So objective is to identify broader patterns of meaning across the dataset. And how we can do it? Group related codes into potential themes. Now we are grouping the codes which we have already identified. The best way is to give the transcript to 2 or 3 researchers, which are they are well trained in qualitative thematic analysis. They can identify their own codes, and once the codes are identified, then one of them can sit with the others and make consensus on the codes. And once consensus is established, the codes with the consensus, they are kept on in one side, and the themes, or sorry, the codes in which there is no consensus, they can be labeled separately. They can be given separate attention later on. So the potential themes, that means if we group the codes, then we can we can see a pattern in those grouping. Categorization of, for example, I am giving here that review the list of codes and look for connections and overlap. And this is also done by looking at the codes again and again, by reading the codes again and again, by discussing with your colleagues, with the other researchers, and then identifying the connections and overlap between the codes. Themes are broader and more conceptual than codes. So, and there is always a hidden meaning in that, a broader concept in that. So like we had the code of time constraints, clinical workload, and scheduling conflicts. They may form the theme barriers to participation, because these all three are actually in the category of barriers. They all are barriers. So barriers to participation can be a phrase which is very suitable to be called a theme. So after when we identify the themes, the fourth step is to review themes. So objective is to refine and validate the themes. Now, how we can do that? Check if the themes represent the data accurately and comprehensively. Then, so you have to go back to the data and check with the theme which portion of the data goes with the themes. Revisit the raw data to ensure the themes are consistent with the participant responses, and highlight the participant responses which comes under that theme, because you are going to describe your theme. Remove, merge, or split themes if necessary. So you have the liberty to change the theme, merge it, or split it into, or make sub-themes out of that theme. So ensure each theme has clear boundaries and is distinct from other, and there is no overlapping. You can try to do that. So the next step will be the defining and naming the themes. So objective is to clearly define what each theme captures. And how we can do that? Write a detailed description of each theme, including its essence and relevance to the research question. Develop names for the themes that are concise and meaningful. For example, instead of calling a theme reasons residents don't participate, you can name it like challenges to resident engagement. That is more meaningful, more comprehensive, and more concise at the same time. So now the sixth step is the writing the report. Objective is to communicate findings in a structured and coherent manner. And how we can do that? Provide a narrative for each theme, supported by direct quotes from the participants to illustrate the key points. And these quotes, they are supporting your theme. And these are the evidence that you are providing from your data. So you have to go back to your data and describe your themes. Relate the themes to the research question and objective, and discuss how the findings contribute to the broader literature or practical implications. So you have to discuss these findings. there are different guidelines for the for publishing such kind of qualitative research. And in thematic analysis, many journals, they allow you to write the results and discussion together, where you can describe your theme and then you can discuss your theme at the same time. And in many journals, I have published with the separate discussion heading. So what are the tips for thematic analysis? Stay close to the data, ensure your interpretations remain grounded in what participants have said. So you don't need to add something from your side. You need to know what the participant has said, because while you are going reading and rereading your transcript, that will make you unable to interpret by staying close to the data. So second is the iterative process. Thematic analysis is not strictly linear. You may revisit earlier steps as needed, and you can reiterate the process. Software tools which we can use qualitative data analysis software to organize and manage large data set, but don't rely solely on them. Your interpretation is the key. So be reflective, be you can say open to revisit your whatever themes you have identified, the way you have described. You can revisit and polish your work. Reflective practice: keep a research journal to document your thoughts and decisions throughout the process so you can revisit them. So it's very important. Now I'm giving you the example of one topic, that was perception of faculty about the level of engagement of postgraduate residents in multidisciplinary CPD activities. CPD activities are continued professional development activities. Here I have 5 examples from sample data excerpts. So the participant 1 said, residents often say they don't have enough time to attend CPD sessions because they are busy managing patients. And another participant number 2, sometimes said, sometimes the sessions are scheduled during peak working hours and it's hard for them to leave their clinical duties. Participant 3, I think residents don't fully understand the value of these CPD activities for their career development. And participant 4 commented that there is little incentive for residents to actively participate in these sessions, and they might feel it's just an add-on to their workload. Participant 5, when CPD activities are interdisciplinary, some residents hesitate to participate because they feel out of their depth. So these were a few excerpts from the sample data. And if we apply the first step of coding, the codes which we can identify from these excerpts, these are time constraint, not enough time, busy managing patient, peak working hours, and then the scheduling issue, another code, because these are the key phrases or keywords: sessions during clinical duties and timing conflicts. So I have made them these two keywords into one code: scheduling issues. Then there were 2 other key phrases like don't understand value, career development not emphasized. And then I have used the perceived value as the code, which has these 2 underlying keywords, key phrases. So lack of incentives, no rewards, feels like an extra burden. This lack of incentive is a more appropriate code for these 2. Confidence issues, hesitant in interdisciplinary sessions, feel out of depth. So confidence issues can be a better theme, a better code for that. Now changing, using the codes to make themes and let the theme emerge from the data. The first theme is barrier to engagement. The supporting code is time constraint and scheduling issues. And in the last slide, we have done this time constraint and scheduling issues. These both are used in the barriers to engagement theme because they are very closely related to each other. So this description, this theme captures the challenges that prevent residents from participating in CPD activities, includes issues such as time constraint due to clinical workload, scheduling conflicts, and lack of institutional support. So we are writing these 2 lines in our own words, but we are using the terms used in the data. And in the support, we have these 2 codes. Here we can add quotations as well. I will be sharing another example with the quotes. The theme 2, perception of CPD value. In this way, the supporting code was perceived value, and with the same one code, I have developed a theme. And here another code, one code, but there is a theme for that. And here again, confidence issue code, interdisciplinary dynamics. Because themes, I prefer to keep themes neutral, not directional. And sometimes we need direction, like barriers to engagement. That shows a direction. They're talking about the barriers. Perception of CPD value, it's general perception. It's not talking about what exactly the perception is. So we can try to keep them like motivation and incentives. But lack of incentive is the code. But in theme, we try to keep it neutral. Okay. So in this way, we now this description of theme is different from other papers. If someone else has a theme of motivation and incentive, the description will vary and the supporting codes will be different and the quotations will be different. Okay. So this was the description of the themes, and now another example. How can we describe the themes in the context? Like healthcare accessibility issues. Many participants struggle to access treatment due to long distances, financial constraints, and lack of transportation. And the supporting quote by the participant 3 is, I live in a rural area and hospital is far away. Sometimes I don't have the money for travel, so I miss my appointments. So this highlights how distance and financial barrier contribute to treatment non-adherence. So here I am giving an interpretation of that, a reasoning for that. And I am describing what are the issues. And this is the quote by which I'm supporting this statement. And I am also highlighting what the interpretation is. Okay. So in this way, the second theme, emotional and psychological distress, is explained. And here is an example from a paper where you can see how the participant number 5, participant number 6, you can add multiple quotes supporting that. And usually I prefer to have some different kind of quotation. I add that in the slide, or some common quotations, so supporting the common code. Then in that way, I usually describe my quotations. So this is a paper from Nurses Engagement on Continuing Professional Development Programs and its barrier in selected hospital in Addis Ababa, Ethiopia. Okay. So the second, now we are going to talk about thematic maps. How can we change the themes into a map? Because we have a structure for a map, we have a central concept, that is the topic, the themes, sub-themes, and codes. So in this case, we have different ways of presenting thematic map. We can make it manually using PowerPoint, Word, or Canva, and start with a central circle for the research topic, add branches, lines for themes, sub-themes, and codes. And we can use software like mind mapping tools, XMind and MindMeister, qualitative data analysis tool like NVO, Atlas.ti, and Mixcuda. They also help in making thematic maps. Here I'm showing the themes from the example. We have sub-themes, we have codes. So these can be presented in form of a diagram or in form of a flow chart. That will be called a thematic map. So here another example of raw interview data from the transcript. This is the quotation, the quote of interview excerpts. Now, if these are few interview excerpts, they are changed into codes where you can see I often miss my medication because I have to travel long distances to the clinic. So they are access issues, transportation problem. These can be the two possible codes. Sometimes the staff is not very supportive and I feel discouraged, lack of support, emotional distress. So there are two codes emerging out of one sentence. The side effects of drugs make it worse. Adverse effects of the treatment. I feel weak and nauseous, which makes me want to stop the treatment. Treatment non-adherence and physical discomfort. These are examples of the code which I have generated from text excerpts. Now, searching for themes, if you use the same codes and search for themes, access issue, transportation problem, they are making the theme of healthcare accessibility. And lack of support and emotional distress, they are making psychological barriers. Adverse effects of treatment, physical discomfort, side effects and treatment burden can be most appropriate theme for this. And treatment non-adherence, adherence challenges can be a most appropriate neutral theme for this. Okay. So once we have the theme, we can define, describe, and quote, add quotes to those themes. So that is the theme description. So like while writing report, again, theme, describe the theme and add the quote. These are some AI-based tools, and Vivo I have just mentioned. Deduce is also another, uses AI to identify patterns and provide visual analytics. This seems to be a good tool, and I have tried this one. And Vivo is good too, but Deduce, I find it much better than Vivo. And this that Max CUDA Analytic Pro offers text analysis with AI-based pattern recognition that can also be used. We have another, Lexi Manser, automates concept mapping and theme discovery. Atlas.ti integrates machine learning to suggest codes and themes. But the best way is to do it manually as well, and then compare with the AI description. So just prepare your data, transcript, and format your data in the required format, and then add it to, for the ethical compliance, remove the names, and then feed it to the tool. When you add it to the tool will provide you with themes and codes and themes. Automated coding, thematic identification, and sentiment analysis is also available in many AI tools where you can, the depth in your themes can be added. So again, a cloud suggested, you can review the suggested theme, combine, split the theme, contextual interpretation can be added, and you can develop thematic maps. You can use word clouds to visualize your results. You can use cluster diagrams to present your results. So once the themes are developed, then you have to present it as well. So then you have to validate your finding with your manually done work. So always discuss with your peers, your team members, qualitative researchers for the accuracy and robustness, because the onus of qualitative research lies with the researcher. So it's his or her responsibility to generate themes, what is mentioned from the data that is mentioned in the transcript. Export and report, export themes, visualization, and insight from the tool. Integrate these findings into your research report and your presentation. So we end here. Thank you so much.